also there, ma'am, but it,
Okay. I sorry, ma'am. I didn't see you.
no problem, ma'am.
Yes,
That's
ma'am.
fine.
YouTube live is start now.
Okay.
Okay.
All the best.
I'm putting it on record also. Sagar bhai, done?
Yes, ma'am. Done, ma'am.
Okay. So good evening. Good evening, everybody. Whoever has joined this session, we welcome you all on behalf of Navrachana University School of Science. This session has been planned to actually, give you deeper insights into the subject that is food science and dietetics, its importance in today's world, and why should a student actually choose a career in this field. So, one of the doctors that we met recently had actually given us a very valuable suggestion that nutrition, dietetics, food science is so important that in today's era, more than the actual hospitals, we need diet clinics so that people stop visiting hospitals and those visits can be reduced, and also that we can have a healthy lifestyle. So today's session is actually on career prospects in food science and dietetics. And we have with us our expert, Professor Sirimavu Nair. Before we go ahead towards the discussion, I would just like to very shortly introduce you to the topic. So, food science and dietetics basically focuses on the study of various nutrients in foods, their role in the body, processing, safety implications, and overall how they impact our health. Dietetics and food science are very closely related, wherein dietetics is basically an applied part of it, which actually talks about how we can apply the knowledge which we have learned in food science to manage health and all the various lifestyle disorders that arise because of not knowing about what to eat and how to eat. This has a very important significance in healthcare industry, wherein it helps to prevent a lot of diseases and diabetes and cardiovascular issues, along with obesity being on the top. It supports public health initiatives through education and nutrition, and you will learn how our expert is also engaged in this particular field and has done a lot of community based work related to nutrition. It also helps in personalized meal planning and diet therapy, which is also the need of the hour, where we can actually surpass a lot of medications and just take few good steps towards health. It actually improves the students' academic and professional growth, equipping students with knowledge which is in clinical dietetics, community nutrition, which is very, very important to, enhance everybody's knowledge in this field. It also inculcates project-based learning, which is actually the heart and soul of this particular field, focusing more on personalized nutrition and nutrition for sports and fitness. A student who actually aspires to take up this course actually prepares himself or herself to work in various hospitals, in various clinics, and also do a lot of research in this area. So, with this, I move over to the actually awaited part of the webinar, that is an expert opinion on the course. And to begin with, I would first like to introduce the speaker. Um, we have with us Professor Sirimavu Nair. Madam is a former professor, was a former professor at the Department of Foods and Nutrition, Faculty of Family and Community Sciences at the MS University of Baroda. Madam has actually worked on a lot of projects which involve the validation of STKs for double fortified salt funded by Nutrition International Canada. She has worked on various projects, including the flour fortification project and the development of iodine test kits for households. In both of them, she has had international collaborations. She has been associated with the State Health Program with UNICEF Gujarat and has been a principal investigator for an ICMR WHO funded multicentric study on loss of iodine from raw and cooked foods. She has expertise in USI, that is the Universal Salt Iodization Program, and also works in the area of community nutrition. Ma'am has published many books on food security, fortification, and community health, and has to her credit, various research papers of which are of national and international repute. So, with this, we move over to the session where we are going to take up some questions which have been posed by the students who are aspiring to take up a career in food science and dietetics. So, over to you, ma'am. And the first question that we have today, ma'am.
Yes, Monisha, thank you so much for
Yeah.
introducing me.
Yes, ma'am. Welcome to the session. So,
Yes, you can go ahead.
yeah. Okay, ma'am. So the first question that we have from the student today is that why should a student do an MSc in food science and dietetics or take up a career in this field?
So MSc Food Science and Knowledge really gives you a good in-depth idea about what are nutrients, what is basically expected out of the nutrients, and how food plays a major role to us. What is a diet? What is meal planning? How do various diets impact our daily lives? What kind of food we should be choosing to consume? Uh, it will also talk to us about different food groups, and we usually will come to know that at least minimum 6 to 8 groups of food we should be rotating in our daily life practices. So some of those aspects will be on the basic line, and then it also gives you in-depth knowledge on what is food safety, and what are the types of microbes which are there, how do we test them, and what are the major principles of food safety, what is food security, what is food insecurity. All those issues are basically covered, and it also talks to us the importance of clinics. We may go and test when we have certain disorders and disease, but we do not have an idea. We may take medicines, but we do not have an idea what food and what food groups would help us. So all this would usually give us a good uh, um, insight into what we should consume, and also a good level of knowledge by which it would talk to us on improving our health, general health, and nutrition. Over to you.
Okay, ma'am. Rightly said. And also about what skills and background does a student need to pursue a career in this course?
So, basic understanding of biology, especially which is required with the gastrointestinal system. That's the prime thing. And a little bit of chemistry, biochemistry, and some clinical aspects on how uh, the test reports, when it comes from a doctor, how to interpret them, what are the cutoff points which are talking to us. So we had some examples very recently. Somebody had an HbA1c of about 6.8 or something. And then people asked, the person I think must have Googled and said, I'll straight away go to start metformins. But we said there is no need. You may also have a iron deficiency. First you check. So there was a deficiency of iron, and we said you don't start metformin, improve your iron. And once they improved their iron, it became better, 5.5 in 2 months' time. Okay, so that means, so it was little difficult for us to educate the patient, because we wanted to tell them that the RBCs bind iron better, and that will not make it a ghost cell, and then it will function better. So, unless and until the person has a knowledge of nutrition, then only they can try to take some of those things into daily life. So those examples, when you Google, you don't get it. because these are again personalized, or unless and until they go to a nutrition clinic, then only they'll understand that. So some of those aspects will definitely throw some light to general public.
Rightly said, ma'am. So it means that people who go to the nutrition clinics and dietitians, they are aware of this fact. But
Right.
students, when they, because they don't know
Students,
how to Google this information as well.
right.
And these are things where in-depth knowledge is the only thing that works, right, ma'am?
Right. And once the student starts doing a nutrition course, slowly, they will get exposed to how to access these knowledge, where to use them. All those will definitely come into picture.
Right. Okay, ma'am. The next question that we have has a broader answer. So this is basically what every student asks. What kind of careers can the student pursue after doing an MSc in this particular course?
Usually, first and foremost is to work as a clinical dietitian. They can be dietitians who would be catering to various institutions. They can plan a diet along with the medicine and make the patient recover much faster than what the medicine would do, because the medicine would be there, but when a good nutrient matrix comes, that medicine works faster, and the patient recovers also faster. So first and foremost is they are supposed to be in a good clinical side, and lot of hospitals do immediately absorb, especially once they complete masters in dietetics aspects. Okay, that's first one. Second is they can be research scientists, they can be quality control officers, they can also work in government agencies, food industries, they can work as food analyst. A lot of food analysts are nowadays, a lot of government agencies absorb them. There are a lot of industries which look for food analyst and scientist. So they start with some research positions first and then slowly move. So ICMR, NIN, Food Technology Institutes, both nationalized ones. Now, recently, Indian Institute of Technologies, 5 Indian institutes have started recruiting people who are food science and dietetics, because they want to do a lot of research and understand various aspects. So these people, once they get a pool of people, they do maintain, and also they interconnect the candidate through one or the other channels. So they really have a good scope. Yes,
Right.
Putsu.
And ma'am, this would be equally applicable to the private sectors also, right?
Yes. All public private institutions, whether it is an industry, hospital, a, a small unit, or a larger gym, then sports nutrition, that's another wing altogether. So they will also take up people, especially if they have done food science and dietetics, because for sports nutrition, they will need to know which type of nutrient, depending upon what kind of sport. Are you wanting to develop muscle, or are you wanting to have a pace setting done, or you want to have endurance, prolonged period of time? Or there are various aspects.
Right. That's also very interesting to know, ma'am. The next question that we have is a very basic question. I think all the dietetic students ask. That is, what is the minimum degree requirement for becoming a registered dietitian?
Okay. So basically, what they look for is a master's in any wing of nutrition. And usually they look more for food science and dietetics. They do say that 4 credits to 8 credits they should have dietetics done, and also an internship which is not less than 90 days has to be completed. And once they complete their entire course, then they can appear for a registered dietitian's exam. So they have to register for that first, and they need to tie up with any of the hospitals which are there. So say for example, they do give classes to these students once they finish their masters. So when they apply, they will ask the respective institution to give a recommendation letter which says the student was sincere or the work was satisfactory with the student, especially when they have gone to 90 days internship. They'll check what was the background of the student when they were in the internship process, because then they will train people who need to become the next RD, and in a year uh, twice the exams happen, and people usually they'll admit these people into the course and train them. So the course is, I think, tailor-made depending upon the kind of students which join. It can be a 3-month course, a 6-month course, depending upon what is the level of the student who is participating. So at present, such courses are there in Mumbai. SNDT gives that, also Nayar's Hospital, then Indian Dietetic Association, they all keep conducting various. So if the student misses one opportunity to join, they can go and join another one. So that's the basic requirement they need.
And ma'am, this Indian Dietary Association membership is also a mandate?
Not a mandate, but unless and until they get connected to a professional group, they will not know many things what is happening. Because Indian Dietetic Association is a national body with their main office is in Delhi. And in each state, they have a chapter, and each district has the sub-chapters. So usually they make a WhatsApp group and connect everybody, and also state-wise people are there and district-wise people are there. They coordinate for a lot of activities and exposures which are given to students or clinicians who are there, and they conduct workshops, conferences, exchange of knowledge which they want to do. So all those usually they carry out, and that's how the association benefits. So they need to be part and parcel of these associations if they need to get all the ready-made information. So nobody forces them, but they need to be a part.
And I think it will help the students if they become a member,
Right.
because that will help them with their internships also.
Correct.
Okay. So, okay, ma'am, we'll move over to the next question. So, yeah, this is a question on internships. So, the student is asking what kind of internships can a student do, and at what type of places and organizations. So, partly, I think you have already answered this question.
There are a lot of hospitals where a student is placed. So usually, um, the hospitals who are training students, they'll get. We need to get in touch with them from the university, and we have like PGI Chandigarh, AIMS Delhi, um, then Apollo's, then then we have NIN, we have ICMR. We also have a lot of other institutions like special centers which are there. For example, any center like a cardiovascular center specifically. Then very recently, these bariatric surgery is a big thing because there is a lot of obesity control on that. So they have certain super specialized hospitals, and they also have uh, various openings depending upon the kind of exposure the student has brought in. So these hospitals are the major ones which will be training the students. So usually we do send them to these kind of hospitals which will allow them to stay back and 90 days and they can be there. So there are specific, some of the super specialties are for liver, kidney disorders and cardiovascular disorders. So depending upon the interest of the student, they can choose where do they want to um, go for their expected careers and internships, because these internships do play a very major role in shaping up their career. And what usually us we at MS, what we used to do is we give the options to the students and they write a small SOP to them, and we also give them, this is the expected syllabus to be covered. So the student is then placed in the clinic accordingly, and we look into the grades which are submitted by the hospital for the student. We don't change the grade because the entire work has been done under a good supervision. So it's better to take the grade which they give us. So that's how we manage currently.
Okay, so a rigorous internship is actually a good thing. The more
Yes,
they do it, the better they would come out to be.
right. So a
Yeah.
lot of hospitals are coming up now, especially super specialty centers, Fortis, Apollo, Vasan, so many, and any and every division, whether it is an eye care division, a brain specialist, a neuromuscular, so many such super specialties are there now. So there is no dearth of exposure, or there is no dearth of training which can be meted to the student.
Right, ma'am. Understood. Okay, the next question that we have is, again, we have partially discussed this. So, which kind of companies? Here, the student specifically wants to know about what kind of industries and companies and the the private sectors normally hire students who have done post graduation.
When we talk of food industry per se, all these food industries do make certain products. So, uh, some industries are very highly specialized for only certain type of products, but some of those industries do make an array of wide products. Not necessary, it has to be a nutraceutical, it could be a wellness product also. So, say for example, in India, more often you would see Nestle, Abbott. These are the two major companies in India. Pristine is another one, and they all have a lot of R&D which goes on. Then we have Marico, we have Hindustan Unilever, then so the depending upon the state and depending upon the place, we have all these companies which are vastly spread across India, and there is no dearth of food industry across India. So these are some of the large companies which are there. There is like Cargill, PepsiCo, and the number of products they keep researching in therapeutics as well as in daily supplementation. There are two wings. The one is to give therapeutics, and that is on a medical prescription, and another one is supplementation, which can be categorized under nutraceuticals, and that goes to public market for wellness basically. So this is how they categorize their products, and that's how they move it into the market. So these large companies do come back to us for placements, and when they'll tell us what kind of students they are looking for and what are the research projects they have. So we put it to students that this is what is coming up and this is what is seen, and whatever is your interest, you can put your CV. And those CVs we forward to them, and when they come, the students would gather and have a good seminar or a question answer session. And they pick up students from, so on an average, out of 10 students, usually such 4 to 5 students do get absorbed very quickly. And the rest will also keep trying. So that's with the bigger companies. Then the government agencies like FSSAI, Niti Aayog, NIN, they also pick up the students and train them for various purposes. And they'll put them as research assistants for 2 years, and from there they give them slow promotions, which they usually then are known as consultants. So junior consultants and senior consultants, because their job will be to completely assist through the programs and the policies which the government is implementing from time to time, help them in calculations, find out what are the products which are there. So these are some of the areas where they would be completely taking up and recruiting students across. So the student has definitely a very wide scope and a large area where they can explore and even change and shift from one place to another. So those options are also available nowadays.
And ma'am, the registered dietitian's course that we talked about.
Hmm.
So, if a student actually wants to join any private hospital, because that mandate is also something which would be for the government hospitals. So, I think still the students can be with the practicing dietitians in the private hospitals. They can
Yes.
join them, right?
So the RD basically is a national qualification. And from there, they can go to public or private hospitals. Nobody is stopping. The RD
Right.
is kind of like how we write a UGC entrance exam. The RD is just a stepping stone to say that you are qualified nationally and can be picked up by any hospitals. The choice always remains with the student. They want to go public funded or private hospitals. Like we have students who are in Apollo, Fortis Gurgaon. As to best of my memory, Delhi has 5 Fortis, Hyderabad has 2, Chennai has 4. So depending upon where these kids are, usually they prefer their home-based towns, and they do go with those options. So there is a wide uh, array of hospitals, I would like to say, public, private, both. We have this Max Well Hospital now opening at various places, and I think the one which I have seen, one is in Delhi, one is in Hyderabad. So a lot of private hospitals do immediately pick them up for various programs which they run through.
And ma'am, our course, actually, what we are aiming at is more of research.
Mm.
So rather than them becoming a practitioner, rather than them settling down immediately post MSc, we would want the students to actually find out the problems which are existing in the society and work and find solutions to that. Because research is something which is required in every field. So I think how would you, what is your take or comment on that approach?
Okay, so in the course, they would be doing something called as epidemiology and research methods. So when the student is taking up that, we should expose them to various uh, public and government databases. These databases have a lot of information. Uh, let's take one example. Look at WHO fact sheets or look at any of the nic.gov.in for respective diseases or disorders. So you will get the prevalence state-wise or country-wise. And from there, they can think what's happening to the nation and the population. And depending upon their interest, we can start making them write some small assignments, a small mini proposal, and like formulate certain objectives. So that will make them clear with ideas, what do they want to do, and how will they approach those problems and concerns. So that's how they usually start with. So we understand what the student will look for. So some of their objectives we have to redefine, formulate it better so that they get the best outcome of that. So say, for example, if we have a student who is interested in fatty liver disorders, because that's now non-alcoholic fatty liver disorders, NAFLD, which we call. It has now a lot of implications. Now, earlier people used to think that only people who are on too much of drinking will have that, or a jaundice can lead into that. But now it's not like that. Any type of cirrhosis slowly goes into it. So a student would be able to look into the kind of aspect which they are interested about the NAFLD and focus their research, look into the database, narrow down to what do they want to do, specifically make a broad objective and then go to specific objectives. Then make the student uh, write some expected outcomes of that. And that will help them to focus on basic research and give them some idea on how to start with. So when they go to the hospital, by the time they reach there for their internship, they'll have some clear idea, because usually epidemiology is taught by the second semester latest. And when the first semester is done, then the second semester, usually they'll get the exposure because they have now some base knowledge of the subject. So at that point of time, we can introduce these aspects to this.
Right. That's rightly said, ma'am. So I think all the participants who are there, they are listening to this discussion. If they have any questions, you can also post it in the chat box, because we have taken up almost all the questions which we had received as a part of the inquiry for the course. So if
Yeah.
we have any questions, we can take them up very quickly.
Or maybe they can raise their hands, or you can open them.
Yeah. So if anybody wants to
Yes.
ask a question, you can
No
just
worries. Yes, please.
either make yourself available, you can post it. Okay, ma'am. So in the meanwhile, I think I will just move towards the next part of it. Most of the questions are answered. And I think this is like a great learning for the students. They would have surely got a lot of information, because mostly the thing that the students look for in any course is the career options.
Right.
How would they benefit from the course? What are how the learning is actually going to help them?
Correct.
So we have I almost touched upon all these aspects pertaining to the course. So we thank you very much, ma'am, for sharing your time with us and for answering all these questions.
Yeah, there's
I'm just
question in
trying.
the chat box, Monisha. I'm
Yes,
studying in first year
first year.
biotech.
Yeah.
Yeah. So once you complete your biotech, by the time you are in your third year, you will start getting an idea what kind of aspects would you like to look into. Now, and you can also say that which type of technology you want to use. So there are diagnostics for a biotech student which is opened up. And nowadays, a lot of new novel technologies are available. For example, I would like to give you one example. Nowadays, a lot of baby foods are coming up with gelatinized products, which are there, which are ready to use, uh, do not need more of preservation, has less worry on food safety aspects. So one needs to look into what novel technology you can apply over there. So it's definitely an open area for a. So we have in some universities we do have food biotech courses also, which is available. So the impact of or the application of biotech into food industries is coming up now in a very major way. One. Second, as I said, as you go ahead, you will be able to develop certain mini instruments for diagnostic purposes, small kits which can be carried, which can be used for testing purposes. Um, and I'll give one example. There's something called as an eye check kit, and it's developed in Germany by a set of such youngsters who have taken up it, and they do have a big funding in Germany, and they can immediately look into various aspects of um, what is say for example, iron content of a food product. So it's just like a small vial. You can carry it to the field, a small set of things. You put it there, you get a food. There is a digester, immediately digest, check. Then and there, you'll come to know what's amount of iron in that. Similarly, they have developed it as to best of my memory for 4 products: vitamin A, iodine, iron, and some amount of calcium. So these you can you go to any field setting and you want to check what's there in the food. These eye check helps you to look into that and measure those content of the food then and there. So that helps the uh, person to immediately suggest something to the government. What is the quality or what is the kind of quantity which is present in the food item which is prepared and consumed basically by the population. So those diagnostics will definitely help, and those kind of things are also coming up in a large way.
I think, ma'am, the student is also wanting to know how the student can actually go for this course. So after completing your BSc course, you can apply for this course because biotech students are eligible to apply.
Right.
I deciphered it that way. If I'm wrong, the student may correct me. So that is what I thought that the student wants to know probably. So yes, you can apply. Once you have completed your graduation, you can apply for the course.
Okay, ma'am. Thank you, ma'am.
Ma'am,
Right.
yeah, there's another student, ma'am, who's asking the same question. That is about she's a student of MSc Zoology, and she's also interested in this course. If I can answer this question,
Sure, please
yes,
go ahead.
you can apply. So I have 2 more slides where I'll give you the information on how you can
Right.
actually approach, and also in the chat box you can just find the information posted by Darshi ma'am. So here you can see that you can just click on the link and you can also go. And in the next few slides, I'll also show you how to go ahead with the further information, where we have a link to the website where you can get more information pertaining to the course. Yes, students. So any more questions? Because this session is basically to answer your questions. And that is what is most important. Scope in nutrition counseling, nutrition consulting. Siri ma'am, there's a question
Yes,
on
yeah.
nutrition
They
consulting.
can become nutrition consultants. Usually, a lot of scope is there for nutrition consultants. So now that depends on um, what type of consultancy they want to provide. They can open up their own consultancy and services, and they can do it in large scale, small scale, depending upon what kind of patients and hospitals do they have around. So a lot of students do opt to start their own counseling sessions in a small way and slowly grow it up. Initially, they may have more time, and uh, what we have also seen is most of the girls prefer to do it for about 5 hours in a day, and then so they have their own time, and also like they may be studying or doing this simultaneously. So we have observed students progressing over a period of time. So by the time it is 2 years, they really get some good patients who are regularly coming to the clinic, and they do have some of the aspects which they literally look into. So that's how they slowly grow up. So that's very open. That's very common, rather.
And actually, I think consultancy and counseling both are a very integral part of this course. So I think yes, that answers your question, student, Mr. Prince. Okay. Uh, do we have any more questions from the audience?
Monisha madam,
Yes, Sandeep sir.
I have just one question for madam. Madam, is there any specialized uh, training required for sports nutrition? Because sports is an industry which is growing. So are these dietetics or nutritionists part of this uh, sports nutrition or sportsman nutrition management?
Yes. So in Gujarat also we have the Sports Authority of India. So usually what SAI does is they pick up the students who are interested and then there is a specialized training given for them. And as I said earlier, these sports nutritionists needs to specialize in various techniques like if they want to do endurance, do they want to do long time basis, they want to do persistence. Depending upon that, they will have to specialize. So um, the Sports Authority of India looks into when they have, say, for example, younger children who are under 19 who come for hockey, cricket, and football. Their requirements are different, their basic needs, structural development, those are looked into and specializations are carried out in that. Though very few people opt for this because you have to be with them on field after your regular hours of work. Uh, we are not seeing too many people taking it up, but we are seeing a lot of people developing food products which would help for them. Because I think that is a booming industry which is coming up and different types of bars and protein bars and less sugar bars, etc. are seen where we see usually people making those kind of products and bring it for testing. So the training which is required for a sports authority would be like developing muscles, as I said, endurance. For example, if somebody is wanting to specialize for 100-meter sprint, then the whole process varies. So depending upon that, Sandeep sir, the students do get exposed and get the training.
Okay, thank you, madam. Thank you.
Well,
So, ma'am, that question was from a sportsman himself.
okay.
Yeah,
Good.
and we have
Yeah.
a question which was posted on the YouTube link. I mean, the YouTube.
Okay.
There's a question from Mr. Vijaya Nadagoda.
Okay.
And the question is, I wanted to ask about PG diploma course in food science, dietetics, and nutrigenomics. And the person is asking if it is a good idea to do a 1-year diploma.
All that depends upon what does the student want to learn from nutrigenomics. Because in 1 year, how much of nutrigenomics will help you? It's a big question. You may get some basic ideas about how and which nutrient uh, is useful in changing the whole aspect of a part of a genome, I'd like to say, because nutrigenomics would take you a regular, at least 1 year exposure just with patients who are needing specialized care. So this area is basically known as specialized nutrition, and there are specialized food products which are made for that. So let's take an example. Somebody has inborn errors of which are there, and let's say that somebody has phenylketonuria or glycemic acidemia, any of those, then the knowledge of nutrigenomics is very highly essential to classify them. So they may learn what is and how it is classified, what is ICD-10, what is ICD-11, how it is being done, and then look into the in that 1 year time, you may not be able to look into a whole genome sequence because you need to have some exposure on bioinformatics for that. But you may be able to look into certain amino acids, restrictive amino acids, restrictive diets which are there. And then they can also make certain food products based on that or regular diets which are based on that and try. So I think 1 year would give them basic knowledge and idea. Unless and until they take it up a little more in depth and do some research on it, then only they'll have a real exposure to the whole thing. Over to you, Manish.
Yes, ma'am. Okay, so I think we are done with the questions, ma'am. And so I would like to go to the next few slides because
Sure.
the questions are pertaining to the course. So with your permission, ma'am, can I go to
Yes,
the next slide?
please go ahead.
Thank you, ma'am. Thank you. Okay, just a second. So basically, we this year have started a new program on MSc Food Science and Dietetics. And this is the eligibility criteria that you all can see on the screen right now. So a student belonging to any of these disciplines is eligible to apply. So if you are doing your undergraduation in any of these courses, which includes botany, zoology, biochemistry, you can apply for this course, right? This is basically the credit framework or the curriculum framework as we call it. So this is actually a program which is a 2-year program. It's a full-time program. There was a query regarding full-time or part-time. So it's a full-time program and the student has to be on campus for all the classes. So here it will be divided into 4 semesters as is the basic semester pattern. And here this is the credit-wise distribution. So last semester essentially comprises of a 6-month dissertation, or in this particular case, the student can also think of going for a full-time internship. This internship can be done either at an industry, depending on the student's interest. That if you want to go for food and packaging and processing industry, you can join an industry. If you want to be associated with a hospital, you can associate yourself with a dietitian in diet planning and management. You can also go for community related work. So community nutrition and public health is also one very interesting field that you can work on. So here we have kept it optional for the students to choose whether they want to do dissertation on campus, wherein they take up a research project and work on it, or they go for a full-time 6-month internship so that they also can become, eligible for an RD. So we do not facilitate RD here. So registered dietitian's course is something which the student can, after finishing their post-graduation, they can go for it. So, but for that, there is a criterion where you have to do, as Madam had rightly said, a full-time internship, which would be minimum of 6 months or 90 hours. Am I right, ma'am? Yeah.
Is 90 days.
90 days, sorry, 90 days. So that is what you are supposed to actually have. So with that in mind, we have developed this credit framework for all of you. And these are the ongoing programs that we have at our school. So we have a full-fledged, MSc program where we have a 5-year integrated biomedical science. And we also offer MSc in clinical embryology, analytical chemistry, organic chemistry. We have this year started a new course, just as food science and dietetics. We have also started medicinal and pharmaceutical chemistry, along with an MSc in zoology and biotechnology and botany and biotechnology. These are our existing programs, and we also have a fully running program MSc in microbiology. In BSc, we have chemistry and the same zoology and animal biotechnology, botany and biotechnology, and BSc in microbiology. And this is the information for all those who really wish to know how to go ahead with the course. So to understand details of the program, you can scan this QR code and visit our website. So where you can get all information pertaining to the course. And for applying for this particular course, you can go to our website, that is www.nuv.ac.in. So I hope this information helps everyone. And we wish you all the best. So on behalf of Navrachana University, I would like to first and foremost thank Professor Sirimavan Nair for sharing her valuable insights, giving us time, and also attending to the queries of the students who had actually, who wish to pursue a career in this field and who wish to first of all know. Also, those students, I appreciate the BSc students who have joined this webinar, because this is very important to know at this particular stage where you want to actually pursue, what career you want to pursue and where you actually want to go. do we have to sit for any exam before admission? So yes, there is an entrance, but it's like a very different kind of a thing. You can visit our website, and we also have a personal interaction, and we have an SOP preparation also, which is just a part of the admission process. So we have counseling sessions, personal interaction with the students. So you can visit our website and understand this in detail. And the dates and other things will be announced soon. So you keep visiting the website for other information. So I think that would help you. So if there are no more queries, with permission of Siri ma'am and Ramchandran sir, can we end the session, sir?
Yeah, sure.
Yes, thank you so much for inviting me, Monisha. It was great to have all of you on board. Specifically, thank you, Ramchandran sir, Darshi madam, Elizabeth madam, Sanjay sir, everybody. Thank you so much.
Thank you.
Thank you, ma'am.
Yep.
It was our pleasure to have you, and
Thank you.
also you have shared so many important insights with us. I'm sure it will help the students, and all those who wish to have any further information, you can always contact us. So I think with that, I would like to end the meeting.
Yes.
So thank you once again. Thank you, everyone.
Welcome.
Thank you.